Good morning, everyone. It's Mimi Guiracocha. It's really hard, but just every letter gets pronounced. A G is kind of silent. It's an Incan last name, so it's actually the name of one of the Incan gods. All right. I'm so excited to be here with everyone. I actually am newer to the DMP field as of December. I got my DMP. Oh, thank you. I got my DMP in public health from Rush in Chicago, where I'm from. But I'm proudly made in Ecuador, so I say I'm Ecuadorian American because I am. I'm the first in my family to be born in the States, and so I'm very, very fortunate to be here with you today. I'm going to be able to talk to you about my DMP project that I did with the Chicago Public Schools on asthma identification and documentations in CPS and kind of why it matters. You can read all the objectives on the screen, but basically I want to talk a little bit about what my research showed in terms of what is actually prevalent in asthma out in the city of Chicago versus what we have documented in school, and why it matters, and what we did about it in our pilot program to teach staff and parents on documentation of asthma and why it's important. And hopefully you gain something out of it, even if you don't work in public schools or school settings or with chronic conditions. So a little bit of background, CPS, at least in the 2021 school year when I was there, it was the third largest school district in the nation. And they have over 600 schools with over 340,000 students. In terms of some of the breakdowns of demographics, about half of them are Hispanic, about 20%, so about a fifth of them are English learners or bilingual, so most likely have a different language at home, most likely it's Spanish. About 36%, so over a third, Black, and then 64% are economically disadvantaged. What that means is that their families' income is within 185% of the federal poverty line. So when we look at CPS, it's really just a great place for us to look at chronic conditions and health disparities. So asthma, in terms of lifetime prevalence, when we compared it across place, and the reason, and I want to actually say this, if you take nothing else, asthma is a lifetime chronic condition. It doesn't go away. And catch me after this because I currently now work in asthma work, but asthma does not go away. Yes, maybe we have misidentified, misdiagnosed kids with asthma and they grow out of it, but if they did, maybe they never had asthma. And so what I looked at was lifetime prevalence of, okay, you were ever diagnosed with asthma. Let's compare across the city of Chicago, the state, and the country. So you can see that nationwide and in Illinois, about 11.5% of kids, this is pediatric asthma data, have asthma. When you look at the city of Chicago, that percentage actually goes up to about 16%. So about 16% of kids in the city of Chicago have asthma. The bottom right, that 5%, is what I looked at the data at actual CPS data. They only said 5% of our students have asthma documented on file. However, that 20% is, if you've heard of the CDC's YRBS, Youth Risk Behavior Survey, when they partnered with CPS and they asked some middle schoolers and high schoolers, have you ever been diagnosed with asthma, among a lot of other questions. And about 20% of them said, yes, I actually have. And so even self-reported student asthma rates are 4 times what CPS has documented. Now, why does this matter? Why am I talking to you about this today? Well, yes, we have about 17,000 students in CPS with asthma because it's, again, a really large school district. However, we could, if we actually looked at 16% and put that to the 340,000 students, we could have almost 55,000 students with asthma, meaning that we have not identified almost 38,000 of them. Again, why this is important is because unfortunately, or fortunately, we have policies in place that say, okay, if we have a student who has asthma, they are, thankfully, eligible. It's their right to have accommodations in schools, to have 504s, individualized education plans or IEPs, which are legal documents that say, I can take my inhaler, I can do this, I don't have to do that, whatever it might be, right? However, if a student does not have asthma documented on file, what happens when they have an asthma attack or an asthma exacerbation? Well, the policy states staff has to call EMS for EMS to come and actually assess the patient. You can't give them an inhaler. They can say, this is my inhaler. I don't know that's your inhaler. Do you even have asthma, right? And so without that documentation, unfortunately, we're not actually giving that student optimal and timely management of their asthma during the school day, which, let's face it, kids are in school the majority of the day. And so what that then leads to If EMS is called, you have the ambulance there, your student is delayed in care, well, all of a sudden now that kid has to go to the ED, right? And what happens then? They might get hospitalized, they might miss school. And we're just driving these disparities that we see with childhood asthma, not just in Chicago, but all over the country. To kind of drive that further, here's from 2017, so about 5 years ago, the childhood rate of ED-related or asthma-related ED visits for Chicago by race or ethnicity. So we see that, I don't know, it's kind of that gray line, that bottom line is the Healthy People 2020 standards. This is data from 2017. I know there's updated standards, but you can see that Chicago average, that line above there, is almost 3 times as high. And when we look at what's broken down by race and ethnicity, we actually see that the driver is non-Hispanic Black children. So non-Hispanic Black children are actually more susceptible to going to the ED because of their untreated or undiagnosed whatever asthma or their exacerbations, followed by then Hispanic or Latino students. So why aren't then people reporting? Why is that 5% so low in Chicago public schools? So looking at literature reviews, doing some parent qualitative data analysis, and surveys, a couple of things stood out to me. First is the process of documentation itself. The policy states, and I'm not sure this is the same for other districts, but once a student has diagnosed asthma, they have to go to the school. The school clerk often will be the ones who give them the paperwork and says, okay, this is what you got to fill out, or they can find it online. But we talked about access to technology, right? Not everyone can just print out a form, have a printer, all of that, so they might have to go to the school, pick up those forms, go back to the provider, whoever diagnosed them, get those forms filled out, go back to the school, find a time that the nurse is going to be in school, first of all, because there's not a school nurse in every school every day, and then sit down and make those plans, the 504 or the IEP. Unfortunately, also in a big district with over 600 schools, not every school has the same resources, has the same communication, is the same size. And so not every parent actually knows that this is what I need to do in order to have my student have access to these accommodations in schools. Especially, again, with not just the nursing shortage, but specifically in schools, Chicago, their goal is by 2024 to have a nurse in every school every day, but that has not been the case to this day. So you think about that. You think about not every school and who has the nurse every day. Which schools? Probably the schools that are maybe in certain areas of the city who have certain money because they're in a certain neighborhood, right? And so we see that disparity again. It's probably no wonder why we see childhood, ED visits be so disproportionately across race and ethnicity and SES in general. Also is limited access and utilization of resources, right? So in that process of going back and forth, childcare, time off work, transportation, medical insurance, all of these things are also barriers to actually parents reporting that to the schools. And also sometimes parents just don't know. I surveyed some parents of students with chronic childhood conditions, and some parents were like, I knew in kindergarten that I had access to these rights. Someone said, I knew just last year, my freshman in high school. So there's huge gaps of knowledge that parents also have. So all of that to say, so what I did was, with my DMP project, focus on training parents and also school clerks, which is an untapped resource, I think, in schools, to hopefully help increase the reporting of schools, or of childhood of asthma to schools, to hopefully improve school management. And some of the frameworks that I'm going to talk about, I'm going to nerd out for a second, is the model for improvement. So PDSA cycles, we talk a lot about quality improvement in public health. And so kind of what are we trying to accomplish? Hopefully improved management of care, ultimately, some of the reduced disparities that we see with asthma. How are we going to do that? Well, ideally, we would see a change in that 5%. Given my limited time at CPS and when I was there, I wasn't able to track that change. But instead, I wanted to see, okay, well, did we change knowledge of the people that we trained? Are they more confident in their ability to report? And then are they likely to do it? Because you can know all you want. That doesn't necessarily mean behavioral change, right? We know that. We can teach people over and over and over again. Doesn't mean that they're going to do it. And then how can we make sure that what we do results in improvement? Well, we partner with key stakeholders in the community, with parents, with school clerk ambassadors to kind of get these trainings undergoing, and also a digital resource binder that can be printed out and then also updated so that this information stays current. I looked at this sociological model, which is a very, comprehensive from the interpersonal level of the specific student and family all the way to policy to kind of create a more diverse and in-depth training. So not just Spanish, because a lot of times we think translation is good enough for culturally tailoring things, but we know that it's not, right? So thinking about doing an English and a Spanish training that have different slide decks, and we're not just calling in and getting translation for certain language, but actually we know that we have slides for you in Spanish, we have slides for you in English, we're gonna give you this training in Spanish and in English, and then all the way to policy, making sure that they know the CPS policy. So 3 components. The first one was parents, so talking to parents about the process of reporting, and in each step giving them resources. So if you need to have the forms but you don't have internet, actually in Chicago we have a program that you can get internet for free in your house. When you go to the provider to get the forms filled out, well, do you have insurance? Do you have transportation? What are the resources the community can offer you? And so on and so forth, to kind of really help them not just know the steps, but what can I do to actually do the steps and actually change my behavior. With the clerks, it was very similar. Okay, what do you know? What questions do you get asked by parents? How can we help you? And what are some of the nitty-gritty questions that you might have? If a student has this form but not that form, what do we do? So did that in our training with them as well. I mentioned the binder. So we had this binder where we had all of that basically in just one form, one in English and one in Spanish, that we disseminated at the end of our virtual training. It also can be printed out and handed to the parents. That talks about, again, all the steps. It has links to all the forms that they need to fill out. It has also the information about the policy, because oftentimes parents are not involved in, don't know about, aren't told about the policies that affect their kids and their lives. And so we made sure that we also communicated that to them. And where can I find a school-based health center? Where can I find an FQHC? If I need to enroll in Medicaid, how do I do that? So we gave them all that information there. With the last few minutes I have, I want to talk about some of the findings that we did from those trainings. So we trained almost 80 clerks from over 10% of the CPS schools, so about 65 different schools were present there, and about 18 parent attendees, the majority Spanish-speaking. When we looked at, so we asked, compared to before this training, how confident are you now that you can actually undergo these steps of reporting your child's asthma? And about 82% agreed or strongly agreed, which is great. It's what we wanted to see. Likewise, well, how likely are you to actually report? Some of them might have already reported or didn't have students with asthma, but everyone else agreed or strongly agreed that they would be more likely to report asthma after our trainings. And then a note about this, unfortunately, when we asked them, well, what are the steps of reporting? We had English and Spanish. The majority of our people were Spanish speakers, and speaking about making sure you're culturally competent, I actually did not translate that last question into Spanish. And so they were like, well, I don't know, I'm gonna pick a random answer. However, I think they gained knowledge. That was my bad. Try explaining that in an article. Okay, so so for the clerks, we did the same thing. How confident are you that you can help parents? The majority agreed or disagreed. I want to spend just 20 seconds. Strongly disagreed, 10 of them. So why did so many say I didn't, 15%? When you know that you have more work to do, you're probably like, oh my God, I'm a clerk and I have to do this and this and this, or how can I help support parents? So that's probably what happened there in terms of okay, I know what to do, but I'm not really confident that I can do it well. But again, the majority of them did identify the steps of reporting, and beforehand, almost no one knew them, so that's just a really great, significant change. So in terms of some lessons learned, thankfully, it was really great to work with school clerks to get their input, to get their feedback as stakeholders that are often actually not brought to the table. I think often at CPS especially, there's school nurses and school clerks, and they're kind of butt heads, because if the school nurse isn't there, the clerk has to, they think I'm picking up some slack, and the school nurse, so there's a lot of kind of maybe, this miscommunication between the two groups. So thankfully, we were able to establish good relationships with the school clerks, also involve some of the nurses. Clerks have the trust of the community. They're the face, right? When someone walks in, if you have any kids or been in a school, you know that school clerks are often really present. It's really important to collaborate with community organizations to support parents in doing the things that they need to do to advocate for their kids' health. And then also COVID-19, right? So that highlighted the need for this. Wheezing, coughing, shortness of breath, all asthma symptoms, also all COVID symptoms. So what happens if a kid doesn't have documented asthma? Like, go home, get COVID tested, wait a couple days to get the results, and then come back. You're missing school. Again, disparities driven even further. Thankfully, we did see that we did increase people's knowledge, confidence, and likelihood of reporting. Hopefully, we can go back and see if that 5% went up, especially in the schools that participated. That would be my next step. And that's all I really have for you. So thank you so much for listening to me. Are there any questions?
I just want to say this is very much needed. I have a child with asthma, and I feel like I am with it, and I still have trouble every year getting that form, getting it filled out,
Yep.
getting it brought back, all the things. So
Yeah.
very much needed.
Yeah. Thank you. Anyone else? No. Yes. Can I talk about my recruitment process? Yeah. 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 What are the so just to repeat the question, recruitment efforts. So for parents, we really thankfully CPS does have a large network of family and community engagement. So I went through them and I said these are the districts specifically, or the areas where I see there's a lot less reporting of asthma in schools, or even a lot of reporting in asthma schools. So I kind of delegated that out to that office and their relationships with the community and parents. So I can't speak too much more into that, but I think if I were to go back now and me being able to be more in the schools, I probably would try to really advocate more for the south and west sides of Chicago, where we see a lot of those disparities. For the clerks, we did say, like, obviously they're doing this for free. They're going to a training out of their time, out of their maybe lunch break. So we gave them certificates of completions. We gave them these like cool little decals that said like, I'm an Asthma ID super user, to say like, hey, we acknowledge that you did this. Like, tell your schools, like, I did this training. I can help your student population, like, value me for doing this and taking time out of my day to do these trainings. So those are some of the recruitment efforts, but I think I would probably do it a little bit differently if I could do it again. Yeah. Great. I want to keep us on track. So thanks so much. If you need to contact me, there's my information.